Effective prioritization is a critical skill for healthcare professionals, especially when dealing with complex and urgent situations. There are several prioritization techniques that can help healthcare professionals make sound decisions in challenging situations. One technique is to prioritize systemic issues over local issues, known as life before limb. This means that in situations where a patient is experiencing both systemic and local problems, the systemic issue should be addressed first, as it may be life-threatening. Another technique is to prioritize acute issues over chronic issues. Acute problems require immediate attention to prevent further deterioration, whereas chronic issues may be managed over a longer period of time. It's also important to prioritize actual problems over potential future problems. This means focusing on issues that are currently affecting the patient, rather than anticipating potential problems that may or may not arise. Maslow's hierarchy of needs is another useful framework for prioritization. According to Maslow, physiological needs such as oxygen and hydration must be met before psychosocial needs such as emotional support. In acute situations, safety needs may take priority over all other needs. Recognizing and responding to trends is also an important prioritization technique. This means looking beyond the isolated readings or observations and recognizing gradual changes in a patient's condition that may indicate a worsening situation. It's also important to recognize signs of emergencies and complications and prioritize them over expected client findings. This means that even if a patient's condition appears stable, healthcare professionals must remain vigilant for signs of complications or emergencies. Finally, applying clinical knowledge to procedural standards can help healthcare professionals determine the priority action in complex situations. For example, the timing of administration of anti-diabetic and antimicrobial medications may be more important than the administration of other medications. In summary, prioritization techniques are essential for healthcare professionals in making sound decisions in complex and urgent situations. Prioritization techniques include prioritizing systemic versus local issues, acute versus chronic issues, actual versus potential problems, applying Maslow's hierarchy of needs, recognizing and responding to trends, recognizing signs of emergencies and complications, and applying clinical knowledge to procedural standards. In snapshot, prioritization techniques. Prioritize systemic versus local, life before limb. Prioritize acute before chronic. Prioritize actual before potential future problems. Prioritize according to Maslow's physiological needs before psychosocial. Acute safety can take priority ATI. Recognize and respond to trends versus transient findings, recognizing a gradual deterioration. Recognize signs of emergencies and complications versus expected client findings. Apply clinical knowledge to procedural standards to determine the priority action, recognizing that the timing of administration of anti-diabetic and antimicrobial medications are more important than the administration of some other medications.